around the country as they tackle the many issues affecting the health and safety of our children.
If today's presentation had a theme, that may be it. How do we face the biggest challenges in pediatrics today? One thing is for sure, we do not have to face them alone, which is why we are so excited for today's guests. Each of the people we're about to hear from have tackled seemingly insurmountable challenges with surprising success.
The first provocation we need to talk about today is the unprecedented crisis of mental health in our youth. You heard an amazing ballad to open this conference, but singing as a way to work through a crisis and addressing it head on in our healthcare systems are two different things.
Our first guest, Johanna Bergan, can teach us a lot about both the problem and the solution. As a teen and young adult, she experienced the challenges and successes of the healthcare system in addressing mental health. She has translated this experience into being an advocate for youth with lived experience in the mental health system. As executive director for Youth Move National, she worked to promote and encourage the inclusion of youth voice in policy change.
Here to deliver this year's James A. Stockman Lecture, a collaboration between the American Academy of Pediatrics and the American Board of Pediatrics, presenting Engaging with Youths to address mental health. Please welcome Johanna Bergan.
Good morning. I would like to begin by expressing my gratitude to the American Board of Pediatrics for their nomination for me to address you as this year's Stockman Lecturer in honor of former ABP CEO Dr. James Stockman, and to offer a deep thank you to the American Academy of Pediatrics for the selection. It is truly an honor to be with you all today. I'll begin by applauding the recent declaration from the AAP of a mental health emergency for children and youth, and to the ABP for highlighting pediatric mental health as a strategic priority. These are urgent and important actions needed to support the emotional health and resilience of the young people you care for each day. There was a time when mental health dialogue would not have been the first choice topic to focus on during a plenary conference address. Now we are living in a society which more broadly accepts our mental and emotional health as a core component of overall health, and we have an understanding of the urgency to address the mental health needs of young people in our country. Not even 1 year ago, the U.S. Surgeon General issued a new advisory on the youth mental health crisis, which has been further exposed by the COVID-19 pandemic. I am relieved that so many of our leaders and each of you are prepared to support the mental well-being of our young people. I am also filled with excitement over the growing commitment to center the patient voice in care and service design, a commitment to the value of listening to and allowing patients to lead in their care is so important to the experience of the young people you are in relationship with. Centering a young person's voice at the center of care allows for increased agency, the development of trust, and builds on the intrinsic value and expertise that each young person has of their own life. And patient voices engaged in our work to make our entire care system more effective allows for young people to help guide us towards building a better and healthier future for all. It is the intersection of these two things, mental health and patient voice, that is my core work and what I hope to share with you today. My work has grown from my own personal lived experience accessing mental health care and receiving multiple mental health diagnoses as a teen and young adult. Mental health care began for me in a routine annual appointment and spiraled into a complex web of necessary support and a journey that has covered many years. There are so many lessons learned in that journey, and today I will focus on 3. The importance of my healthcare providers being able and willing to address mental health concerns with me, the evolving experiences of mental health stigma that young people are experiencing today, and the value of a team of supports and the important role that you can play on that team. My lived experience in the mental health system overlaps with my professional work and has grown to encompass the experience of thousands of young people across the country who are currently navigating our country's social systems. And that comes in the form of the work that I've done at Youth Move National. Youth Move, standing for Motivating Others Through Voices of Experience, is a national chapter-based organization filled with young people with lived experience in navigating child welfare, juvenile justice, and the mental health system. They bring their experience to decision-making tables to ensure that services and supports improve and actually meet the needs of young people who are accessing the services. And I've been proud to be its executive director these past 7 years. At Youth Move, we believe that the best care and support will be offered when young people's voices are centered in the design of the system of care. Today, I weave my own experiences with those combined of young people across the nation, and I hope I do them justice in what I share with you. Let me first address the importance of healthcare providers being able and willing to address mental health concerns. It is more than okay to talk about mental health with your young patients. In fact, it's exactly what they need and want. Talking about mental health for both the patient and provider can feel big, sometimes even scary. It might not be an area that you've specialized in. You might not feel like you're equipped with the exact right words to use and say. I would love to set your mind at ease. First of all, young people are already talking about mental health way more than you can possibly imagine. The narrative and willingness to talk about anxiety, depression, and mental health in general has changed and shifted so much in the last 10 years. My own experience navigating care began at the tipping edge of this change, and now, on a daily basis, mental health is being talked about and is front of discussion among teens. The dialogue around mental health has changed more broadly as well, and is now being talked about in schools, faith communities, and even at the corner coffee shop. Now, I am not implying that we have busted all of the stigma around mental health, because we definitely haven't, and there is deep and critical work for us to remove the real barriers and remove the stigma and discrimination those of us with critical mental health diagnoses hold. But day to day, the experience of discussing and seeking support around mental health has definitely shifted in positive ways. Mental health language isn't scary and is in far more general use among teens than ever before. I see and talk to young people about this daily. Teens and young people are increasingly turning online to look for mental health, find out about it, find resources, and figure out some coping strategies. And there is a plethora of information to find. We have all gotten better at this online world, whether we like it or not, thanks to the pandemic. And young people were quick to couple their increased emotional distress with their online community building. And I'm here to tell you, if TikTok is currently answering my mental health questions and giving me my best ideas to find support, I should definitely be able to talk about mental health with my pediatrician. We brought together hundreds of young people in discussion groups across the Youth Move chapters, asking them what most helped in the mental health resiliency journey and what most helped. After sifting through thousands of insights, the most frequently repeated form of help was to have adult helpers, meaning teachers, doctors, and other professionals, having the language to talk respectfully about mental health and then be able to offer some sort of help. When you, as the provider, are the one to start the conversation and bring up questions around mental health, anxiety, depression, this normalizes talking about mental health. This is such important modeling from a caring adult, you. Our ecosystem is shifting to support these conversations now. Now that the recommendation is to complete an annual depression screen for all adolescents, there's a regular opening for us to bring mental health into routine physical health care. All too frequently, in accessing mental health care in my own journey, I had to initiate the conversations, ask the first question, show up with a reminder to share about my increasing anxiety or talk about a new symptom I was managing. This took so much courage and literal practice to find the words to say each time. Even now, I experience such a huge sense of relief and gratitude when a provider acknowledges the mental health concerns I've had and asks how I'm doing emotionally right now. It feels so good for you to help us start the conversation. Perhaps you practice asking about mental health with all of your patients, or you have a practice to push past the first response of "I'm fine" to ask a second time. If a depression or anxiety screen result is available to you, please follow up on the results with your young patients. It takes courage to mark what we're actually experiencing, and so supportive when it's followed up on, and frustrating when it's not. Sometimes there isn't anything to address, and other days it is the exact door opening moment to ask for help that I've needed. It takes a community to support a teen's mental health needs. It's not your job alone to support mental health needs. Supporting young people's mental health takes a team that includes themselves, their family, their friends, and healthcare providers. Some of this team is ready-made and within a young person's community already. We know today that young people who are experiencing emotional distress reach out first to other young people. It is other teens that they ask for support and help from first. Because we know this is how teens are using help-seeking behavior, we can maximize this. And in fact, there's a growing movement across the country to do just that. There are a growing number of youth peer support services. There are organizations that likely exist in your own community that are offering some youth-to-youth support. And looking for them at local community organizations within schools is a great place to start. You can also check to see if there's a local Youth Move chapter in your community and suggest that teens reach out directly to engage in programming, advocacy, and peer support. Planning for teens to bring friends and peers into their web support is a sound expectation, and the power of youth-to-youth support is real. The very first conversations I had to process my first mental health diagnosis happened with my best friends, and I remember them to this day. Family are also key team members and will likely be an active support to engage and discuss mental health concerns and available resources to navigate. Let's not forget that for many young people, the importance of family of choice in bringing family into their support work. Many young people may be getting their most vital support from aunties, neighbors, teachers, in similar ways that others receive support from their bio family. And you are on this support team too. Starting the conversation about mental health and asking caring questions to identify things that a young person you are providing care for needs is an essential part of healthcare. And in fact, it's a key power you hold. Having your pediatrician on your mental health team as a teen is so important because of all of the resources and knowledge you hold. Other key powers you have to use are your powers of acceptance and connection. Acceptance is so powerful and affirming. Most of us understand that bringing up an emotional health challenge in an appointment isn't going to fix anything overnight. But the dialogue can serve as a critical spark of hope, and that there is a potential for support and relief available, and that emotional distress is real and valid. Because we are still in an evolving understanding and acceptance of mental health concerns across our country, confirmation that how we feel and respond to those feelings is important, and it can feel so grounding to a young person who is struggling. And in fact, it feels pretty affirming even if there's not an explicit mental health concern present. Having a caring, knowledgeable adult bringing up mental health is important. Other parts of the web of support young people need to navigate establishing emotional resilience are part of the formal network of healthcare, and pediatricians can be key to finding the right people to support a young person. Your ability to validate, refer, connect, recommend, and network are all superpowers that you hold. For youth and their family, knowing that you care about helping them identify and access specialty mental health care can be such a stress relief. Sparking the conversation about emotional health does not immediately saddle you with the requirement and need to fix everything. It can be as simple as starting the conversation and beginning a process to identify additional mental health resources. I worked on a project with several young people, exploring how adults could be most helpful to support their mental health after experiencing a traumatic community event. And one of the most striking learnings was that of all the formal intervention practices that had been offered, the one that was most essential in their eyes was to have adult helpers approach them with an open mind, heart, and ears, and bring trust, empathy, and acknowledgement to the relationship. In a world of numerous complicated interventions, this one feels pretty straightforward and manageable. Introducing mental health dialogue into a patient interaction provides you a great opportunity to center young people's voices in their care. I promise that far more often than not, a young person is waiting for youth mental health to come up rather than hoping that it does not. Allowing young people to discuss their full spectrum of health in their relationship with you opens the door to a thriving future, and we all want to say yes to that. Listening and following the lead of young people's responses and interest engaging around mental health concerns, be that feelings of increased anxiety or periods of depression or the presence of greater concerns, can and should be a beautiful part of our relationships between pediatricians and patients. For those of you here today who would like to explore strategies to begin the conversation on mental health supports and to build your skill and confidence in doing so, I would like to mention the wealth of resources available to you at the Roadmap Project. This is a project initiated and supported by the American Board of Pediatrics. The resources include a video presentation of a pediatric psychologist talking about how to start a conversation about emotional health, resources to raise your awareness, build your capacity, a tool to help you link resources directly to patients, and support around implementing bringing mental health into your regular practice. These resources are easy to use and available for you, and I feel like it's important to call attention to them because they exist because of the explicit advocacy of patient and family who viewed it so important for you all to have access to these resources in order to bring mental health conversations into your care. It is imperative to listen and learn from and with young people to gain a deeper understanding of how adults and systems can create the culture and conditions that center emotional and mental well-being. The stories that I have heard over and over from Youth Move members is that the experience of not being listened to, of not truly being heard by doctors and professionals is disappointing, demoralizing, and builds a lack of faith in the systems that were designed to support us. This experience is often turned around by one single adult sitting down and truly listening. Someone shared with me that I never felt like I was being listened to. I just felt like I was being talked at. And when the opportunity to be heard finally came, it gave me hope and it gave me a voice. It taught me that I can take what I viewed as my biggest weakness and turn it into one of my greatest strengths. Here's the thing that I know. Each and every one of you has the power to change the narrative on mental health and help a young person get the support that they need. And it all starts with our words. Being the one to normalize and prioritize mental health in overall care is the start. Open the door to an opportunity for young people to engage in conversations and identify needed supports each time you meet with a patient. Approach caring for the emotional and mental health of the children and youth as a team sport. You are on the team and you have an important job, And your most critical task may be to identify and connect to other helpers. None of us are alone in this work, and that is a beautiful and supportive reality. And finally, center young person's words, goals, and reality in all of the relationships you hold, and let them guide the course of care. Honoring a young person's voice as expertise in identifying the support needed is empowering and emboldening to each young person and allows us all to work together for health. Thank you for letting me prioritize the topic of mental health. Thank you for your enduring work to care for children and youth. And most of all, thank you for the many conversations about mental health for those that you care with, that you will have for those that you care with in the months and years to come.